So, today we're going to talk about something that's very hard to diagnose. These medical mysteries, but not in a sense you think about. Something very common, yet very difficult. One that I called a neurologist for, and they don't really want to get involved, even though it's part of their job, part of their scope of practice. Altered mental status. I'll tell you which specific type, because there's different types of altered mental status. You could say whether their mental status, their level of consciousness is up or down. So agitation, hyperactivity, psychosis, the brain's working too much. Somnolence, the brain's not working that much. They're barely awake. Barely arousal, the worst is obtunded. Non-responsive is a term that we don't use very lightly. Obtunded neither. It's basically that they're not waking up no matter what you do. Even if you smack them in the face, they still wouldn't wake up. We don't do that because that sounds sort of bad. We usually do something like a sternal rub, or you could take their fingers and just really jam down on the nails. And the confusion, they're there, but they're confused. You see it often in elderly people, people with dementia. There's this particular term of confusion that we call confabulation, and you see it often in alcoholics because they have no idea what went on, but they'll tell you a good story about what happened yesterday anyways, even though they blacked out. So I'm going to talk today specifically about this idea of being too sleepy, decreased level of consciousness, somnolence. What does that mean? So for some people it's easy. You shake them, they don't wake up. You really shake them, they still don't wake up. You yell at them, you put a blowhorn in their ear, they still don't wake up. But if somebody's not that bad, is it an issue? Let me give you an example of my patient. I thought she was too sleepy. Someone said, well, she hasn't slept a lot. She needs to just catch up. Okay. How long do you need to catch up for? I mean, if you're sleep deprived, is it just that you catch up for your whole life? I mean, then when there's periods that people don't sleep, like, but 4 hours a day, and say you're supposed to sleep 6. So say they go that way for a whole year. They're working, as an intern at an investment banking firm or something. So they're owed 2 times 365, 700 hours. So they're going to sleep basically 30 days straight? That doesn't make sense, right? How much is normal? I mean, everybody says they need a certain amount of sleep, right? But some people need more, some people need less. If you don't get sleep last night, right? Say you get admitted to the hospital, does that mean that you're allowed to be sleepy today? I would think so. How sleepy are you allowed to be? Oh, I don't know. And then the other question is, what if they don't think they sleep too much? What if they think they're perfectly awake? What if they don't realize that it's an issue? Can I come in and say it's an issue? I guess so. I mean, I did, but... And then there's the people who do think it's an issue, and they tell you they don't have enough energy. They're just tired all the time. So they're awake. They just feel tired, sluggish. They're not falling asleep. I think that's a separate issue. So I'm going to talk about my patient who came in very, very sleepy. So her story is interesting. She's in her 70s, recently diagnosed with something called temporal arteritis, which we classically have this pain, forehead, inflammation in your blood vessels, treated with steroids, though I guess you could use other stuff as well. Either way, she's on a lot of steroids for a long time and is brought in because she became paranoid, crazy, this or that. What I noticed was, so we dropped her steroids down, we put her on some antipsychotics. What I noticed is that she was very sleepy. She falls asleep when I'm talking to her. Is that normal? Well, I mean, does it depend on how long you talk? Maybe if I talk for 10 minutes, people get bored. Of course, anybody will fall asleep, right? If it's just for a few minutes, is that okay? And when you say, falling asleep on you, my dad falls asleep. I mean, I don't think he has any issues. He just probably doesn't sleep well at night, has some sleep apnea, so doesn't get good rest anyways. The funny thing is, even though she's so sleepy, she's not in the same position all the time. She'll move herself from the bed to the chair, from the chair to the bed. So I guess she's got to be awake enough to move. She thinks there's no issue. She thinks she's fine. What's wrong with her? How do you figure this out? So something obvious happened, like someone had a major stroke that took out half their brain, and they're sleepy all the time. You're like, oh, well, that's to be expected, because the brain has to do with your consciousness, and they're just not very conscious. But with this lady, what is it? Is it medications we started her on, the antipsychotics? We started tapering those down, and that didn't really change things. Is it that her sleep-wake cycle is reversed, so she's just very sleepy in her day, even though she's up at night? Is it that she was used to a lot of steroids that gave her energy, and now that we've come way down, she doesn't have that anymore? I mean, we did all the standard testing. We did, imaging of her brain, including an MRI. We did a lumbar puncture to check for infection or these things. They're all trickling back as negative. Nothing there. 0 white blood cells in her spinal fluid, which basically means no infection. You can't check anything like, her adrenal response because it's already suppressed, and we have her on more steroids than we think anybody needs to support their daily functioning. We don't fully understand. People say, and neurologists told me about different things you need to knock out to make somebody unconscious. But she's not unconscious, she's just sleeping. Are we conscious when we're sleeping? Are we unconscious? I don't know exactly. We also did the EEG to look for seizures, even though this is not normal for seizures, but I guess you could never say someone doesn't have seizures. She didn't. So what's the answer? So I think these are the most difficult questions in medicine when, first of all, the problem is not well defined. If everybody agrees there's a problem, that'd be great. If some people agree, like say the doctor that says there's a problem, the patient says okay, that could still be fine because there's some things we say the patient wouldn't notice. But being so sleepy, would you notice that? Or would you not? Does it carry over so even when she is awake, she's not fully there? The second issue is something being ill-defined. Heart attacks. Pretty easily defined. Check some lab markers like a troponin, look at an EKG. You get an ultrasound of the heart, see if there's any damage, it doesn't pump as well properly. Strokes, you can usually see something on MRI, have classic symptoms. But this one, how do you define? What is normal? Normal, I would say, we say for sleep, obviously has to depend on the person. How awake they are, some people are never that awake. They just sort of go through life like this. Ill-defined. No proper way to test. The patient doesn't think it's an issue. What do you do? I said, we finish all your testing, you'll just have to follow up in the clinic. Probably get some help at home. And send her on her way.